eClinicalWorks sat down with Block & Nation, PA, a 4-provider family practice located in Oviedo, Florida, to see firsthand how the eClinicalWorks comprehensive EHR solution with unified practice management has made a positive impact on the day-to-day workflow and ROI of the practice. eClinicalWorks spoke with Dr. Bradley Block, Chief of Medicine and board-certified family practitioner, and his staff, as well as Mark Schulman, who's been a patient of Dr. Block for 10 years.
So Mark, we have your results back from your blood work from this morning, and it actually looks like everything's doing very well.
My name is Mark Schulman, and I've been a patient here perhaps 10 years, known Dr. Block for a long time, and I was with him before he had the electronic medical record systems and after. One of the things I really appreciate about it is the efficiency of the prescriptions. I love the way that he can send it to the pharmacy, and before I can even get to the pharmacy, they've got it. One of the things that I really like about the new system is that when I discuss lab results and blood work with him, it's very easy for him to be able to see previous results. So as we're discussing today's results, he can say, back in November it was this, and in August it was this. So it's very easy to see all the results side by side, and easy for me to understand the display that he's looking at as well when I see it.
Practically, we can do almost everything in the clinicals instead of getting up and do it manually. So it's very, very convenient and faster. That's the main importance of ECW. You do your job faster. We also started our new version of a web portal where patient can request an information and send an email to the doctor.
I love the portal, and I love being able to make appointments and request refills without having to call in, and they handle that very efficiently.
Any of our patients need something, immunization form, something faxed. It's so much easier to go in their chart and fax it right away through the clinicals instead of going to the main fax machine to be faxed.
What I love about eClinicalWorks, it's so easy to use. It's basically error-proof. Check-in process is easy. Checkout process is just as easy. And billing with the electronic payments, when they come from the insurance company, there's very little that we have to do besides input it to the proper patient.
As the process for everyone, it's always like the change is like always scary for everybody. But it went pretty well. It was easy. I mean, eClinicalWorks, you could basically teach yourself, because any 5-year-old, you put them on the computer and they can go through it and just figure their way out. We worked it out, and we can't even imagine our life without eClinical today.
Certainly, eClinicalWorks is extremely easy to use. I mean, even as we've hired new staff, I mean, they adapt and they learn how to use it very quickly and easily. You know, as new versions come out, it's very quick and easy to figure out how to use all the new features and new versions. Worked with, you know, I've known a number of doctors that have gone on eClinicalWorks, and I've coached them along a little bit with how to get more efficient, but in terms of actually learning the features and using the features, they've all found it easy to use and easy to learn. By the end of the first year, the 3 doctors have been with us full-time for at least a year prior to implementing the eClinicalWorks, on average brought in $20,000 more per doctor to the practice before overhead than they had the year before when we were on paper charts, and that's despite having brought in a 4th doctor who was taking most of our new patients and handling our overflow, and despite the fact that we limited our schedule that first month as we transitioned and got used to the implementation process of going from paper to electronic charting. I found the P2P to be very helpful. There's actually several gastroenterology groups and some other specialist groups in town here that are on eClinicalWorks and are using the P2P with us. And for example, you know, 2 features I found very helpful. One is just being able to transmit the patient information is very helpful. So I've had some patients, very complex patients, on 20 or more medications and lots of medical problems and medical history and past surgeries, and be able to transmit that to the gastroenterologist. And I think of one patient example, the gastroenterologist told me it was invaluable to him because they had a list of exactly what the patient, what medicines the patient was taking, why the patient was taking them, their medical history, the labs that I transmitted, some radiologic reports, their surgical history. And so they said it normally would have taken like a half an hour minimum for the nurse to get all that information and put it into the chart. But instead, it took 2 seconds. They clicked on a few hours. They imported the CCR information, hit a couple little blue arrows to import it right into the chart, and it took seconds, and it was all completely accurate. And then when he was done, the gastroenterologist, he just sent me a consult letter back through the P2P as well, which was simple. From my standpoint, it's our software gets better and better. So as the years go by, as every new version comes out, it's the EMR that just gets better and better and better as year after year. So.
Block in Nation and eClinicalWorks, improving healthcare together.